Good evening everyone. Ramadan Kareem to all of you. Welcome to a brand new episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. I am Anupama Menon. Your health is our concern. In this talk show Health World, we have expert doctors from various fields providing valuable information to assist you all on your journey towards good health. March is observed as the month of endometriosis awareness. Endometriosis is a disease that affects the female reproductive system. It can be quite a difficult condition to deal with as it's extremely painful and it's also linked to infertility. So it can actually take a toll on the person going through this physically and emotionally. To shed more light on the topic of endometriosis, today we are joined by Dr. Jasmine Sankaranarayanan, specialist obstetrician and gynecologist from AL-HILAL Hospital, Salmabad. She comes with an experience of over 12 years in the field of gynecology. Let's go over to her and know more about the disease of endometriosis. Doctor, good evening. How are you doing today?
Yes, all good. How are you?
All fine, doctor, by God's grace.
Okay.
Welcome to the show once again.
Thank you so much. It's my pleasure.
So as we said, March is the month of endometriosis. Yes. So through this episode, I think we should do our bit by creating more awareness about this condition, because I believe a lot of ladies suffer in silence with this condition.
Exactly.
So before we start off, for the benefit of our viewers, if you could just define endometriosis in medical terms.
Okay, before I go to the definition, we will just revise a little bit of our anatomy.
Sure.
That is, the uterus has 3 layers, the outermost layer and the middle muscle layer. And this muscle layer, innermost to that, there is the uterine cavity is lined by the endometrium, okay? And these endometrial cells is what is sloughed out along with the endometrial fluid, the menstrual fluid, during the menstruation. So now when these endometrial cells, instead of going out, it is going inside and going and getting deposited on other organs, the neighboring organs. This condition is what is called endometriosis. And when I say the adjoining organs, you should be wondering like what all must be closest, you know. So anything that is going outside the uterus, like even if it is the lower layer of the lower part of the uterus, which is called the cervix, or even when these endometrial cells are getting deposited on the surface of the uterus, these all are like, we call it endometriosis, right? Because the endometrial cells should be only within the uterus in the innermost lining. So the most common organ that is affected with endometriosis is the ovary, because it is lying in very, very close relation with the uterus. Then other than the ovary, the fallopian tubes can be affected. Then the nearest neighbors of the uterus, which is the urinary bladder, the bowel, that is the intestines. And it can, you know, even the distant organs can get affected, but very, very rarely. Like we have had conditions where the lungs are affected, so that is the thing.
Okay, even the lungs could be affected because of this.
And that is extremely rare, but it happens.
But
sometimes.
mostly it is the closed organs, the organs lying close to the uterus.
Exactly, yeah.
Okay. And what is the age group that is more prone to getting this? Does it happen amongst teenagers, or is there any particular age group which is more at risk of getting endometriosis?
Like many other gynecological conditions, even this condition is mainly affected our predominant hormone, that is the estrogen, okay, which is predominant in a female body. So this estrogen, because being an estrogen dependent condition, the women who are more prone to be affected are women with early menarche. That is when you get your periods. The puberty is strikes earlier than normal. Earlier it used to be around 13 or 14 years of age, the first period, but now it's coming earlier and earlier because of our lifestyle.
Yes, in today's times I think most of the girls get it by 10 or 11.
Correct.
Maybe because of our lifestyle.
That is the thing. So the more number of menstrual cycles a woman has in her lifetime, she has more chance of developing the endometriosis. So early menarche is one risk factor. Then even women with who are getting their menopause late. That is earlier it used to be around 50 and all. Now it's going even beyond 52. They are striking, the menopause is striking. So all these women who have more number of menstrual cycles, they will be getting this. They have more chance of developing endometriosis. But the most commonest age group we see is definitely the reproductive age group because of that. Because it is during these reproductive years that the estrogen is more active in our body. So if you ask me an age group, I would say it would be around 20 to 45 years of age.
So basically, the more the number of menstrual cycles, the more they are at risk. So
Yes.
early menarche and a late menopause are the
Yeah.
risk factors.
Yeah, right.
And what if you could also list out the other risk factors of endometriosis? What should a lady look out for in the
Yeah.
case of this condition?
The other risk factors, like if she is having, some other gynecological conditions like fibroid, adenomyosis, as I said, all these are dependent on the estrogen only.
Estrogen.
So these women are having a higher risk of developing endometriosis. Then one thing, unlike other gynecological conditions where a high body mass index, that's more obese women have higher chance of having this fibroid and adenomyosis. Endometriosis is somehow seen to be in women with low BMI also. So that has not been exactly, we are not able to explain it very correctly. But yeah, these are the most common risk factors for these. And other than this, we also have a genetic element to this. Like if a woman has her sibling or her mother has been affected with endometriosis, she is said to have at least 7 times higher chance of developing endometriosis.
So it could be hereditary to a certain extent.
Sure, yes.
And what are the causes of endometriosis?
Well, unfortunately, we couldn't pinpoint any one cause till now, but a lot of theories have been postulated and, told about endometriosis. So I would like to, describe the commonest theory. That is the theory of retrograde menstruation. So as I told you, like we all know that during a menstrual cycle, under the action of the female hormones, that's the estrogen, this endometrium will just build up, become thicker and thicker. And it is like kind of preparing the uterus to accept a pregnancy. That is the physiological thing. But if at the end of the menstrual cycle, a lady is not becoming pregnant, so that endometrium, that thickened endometrium just sloughs off. It gets shed off, okay, with the menstrual fluid, and it has to escape out through the vagina. But because of the uterine cramping probably, these endometrial cells and the menstrual fluid and all, it takes a retrograde direction. And instead of going out, it will traverse through the uterus and into the fallopian tube, and through the fallopian tube, it will spill out into the abdomen. So that is the most logical explanation we have found for this, that is how these endometrial cells reach inside the abdomen and get deposited on the nearby organs. So that is one thing. But like we have not been able to completely explain that also, because many of the women have retrograde menstruation, most of us have it, but not everybody is developing endometriosis. So the other theory that is we are trying to explain this situation is that these endometrial cells may be traveling through blood vessels and our lymphatic vessels and all, and reaching all other organs, like even the distant organs. That must be the reason how they reach it over there. So these are the theories, but yes, the commonest is about the retrograde menstruation.
And what are the symptoms? Because lot of women experience severe pain during their periods, which is quite common. So is this, as we know, this is also one of the symptoms of endometriosis, but are there any other symptoms that we should look out for other than this?
You are right in saying about the pain, because pain is the most debilitating and most troubling symptom.
Yes.
See, most of us will be having pain during periods, maybe for 4 to 6 hours during the first day of the period. That is what most of the women experience. So that is like something bearable, because that's only for that many hours, and usually it subsides with a tablet, with just a Panadol or something.
And you are back. Lasts only for a day also, maybe maximum 1 or 2 days.
Maybe for 1 or 2 days, okay, at the max. Yes. But you can just imagine when a woman is suffering this every day, okay, having the pain every day, and that is the worst thing about endometriosis and what bothers most women, and that's how they reach our clinic. And the commonest symptom being the pain. So it is not that it just starts with the period. It may start a few days before the period, slowly increase, progress in intensity, become unbearable, and they end up coming and asking us just for injections, because no amount of oral painkillers is affecting, it's not helping.
Pain is so severe.
Pain is very severe. And unfortunately, even after the period begins, they expect that, okay, now slowly it will decline, but it just goes on for a couple of days more. And in worst cases, when these endometriotic deposits are seen over the ligaments that attach the uterus and the abdominal wall, the pain becomes severe. There will be back pain and there will be abdominal pain, and it goes throughout the cycle. Because the reason for the pain being throughout the cycle is because these endometrial cells will be under the effect of the hormone, right? So they will be just enlarging, and the endometriotic deposits inside the abdomen, like unlike in the uterus, they don't, that blood cannot escape out anywhere. So that's why it just becomes larger and larger, and that is the reason for the pain. So it's not just period pain, there will be pain throughout the cycle, and some women also experience pain during intercourse. So the huge aspect of this condition is the pain, which needs to be addressed. Then the next, there will also be some like menstrual irregularities with this condition. Most of them may have their regular periods, but the bleeding may be slightly excessive. So that is another thing. And and the one thing that is now a major concern for both the doctor and the patient is the increasing number of cases of infertility, because endometriosis in a huge way is affecting the fertility of the patient. At least 50% of patients with endometriosis is suffering from infertility. So these are the commonest symptoms. Now coming to the less common symptoms but equally troubling or more troubling, I would say, is when these endometriotic deposits are seen over the urinary bladder. So you can imagine when it goes and affects the urinary bladder, the patient will have pain even while passing urine. And sometimes there will be bleeding also when she is passing urine. The blood comes out with the urine. And suppose the deposits have gone and attached on the intestine, she can have pain when she is passing stools and even bleeding per rectum. So these are really hard conditions to treat.
A lot of other complications.
Yes. So that is like more complicated and hard to treat, you know.
So pain would be persistent. Unlike a normal period pain, the kind of pain that a patient goes through when they have endometriosis is more severe in intensity, and it can last for a longer period of time.
Yeah.
Okay, and you also spoke about infertility. So can you please explain to us a little bit in detail about how endometriosis affects infertility?
So like when I'm telling about these deposits, you know, they don't just go and innocently sit over there on the organ. With each cycle, they keep on increasing in size. And as I told, the most commonly affected organ is the ovary. So when a deposit, endometrial cell goes and gets deposited on the ovary, it, you know, slowly gets getting converted into a cyst. Initially, the cyst will be very tiny, maybe 1 or 2 centimeter. Then with the action of the hormone, the cyst will become larger and larger till it may even reach 7 or 8 centimeter in size. And when the cyst is becoming larger and larger, it is replacing the normal ovarian tissue, and it's destroying ovarian follicles. So these follicles are needed for the pregnancy to happen, right? But these are getting destroyed over a period of time. So the ovarian function is damaged. The ovulation, that is the production of the egg for fertilization, does not happen. Moreover, it is the fertilization of the egg and sperm is happening inside the fallopian tube. So because of this endometriosis affecting the fallopian tube gets distorted. There will be kinking. It's like a, you know, like a long tube, and it gets attached to the uterus here, then gets attached to the ovary somewhere else. So there is a kinking of that tube, and there will be blockage also. So this egg is not going and fertilizing the sperm in the first place. Now just in case it fertilizes also, because of the blockage, it is not able to travel back into the uterus and get deposited over there where the normal pregnancy should happen. So that can result in an abnormal pregnancy. That is the reason why more number of ectopic pregnancies are happening.
It's outside the uterus, right?
Ectopic means it is the pregnancies occurring outside the uterus, which can be very dangerous. So these are the problems. These are the different ways in which endometriosis is causing infertility.
So this is a serious condition. It can affect fertility to a great extent, I guess.
Yeah.
And what is scar endometriosis?
Okay, scar, like yes, I think I forgot to mention that itself. Like these endometriosis, I told you about the commonest organs that are being affected. So the scar is not an organ. Scar, when I say scar, I am meaning surgical scars. there are surgical scars when you have had surgeries for the lower abdomen and in the pelvis and all. For example, many of the women are having the cesarean section done, right? So when there is a cesarean section scar, so this endometriotic deposit is going and depositing on the scar.
Inside. You mean
Yes,
inside the scar? Okay.
inside the not on the skin, just below the skin.
Below the skin,
It's
okay.
getting deposited over there. If you have had a cut in the perineum to have a normal delivery, so that episiotomy, we call it the episiotomy, no? So that episiotomy scar can get affected. If somebody has had a laparoscopy, the laparoscopy scar is usually put over the umbilicus. So over the umbilicus there will be a scar. And the presentation was initially like difficult to understand what this patient is complaining, but slowly over the years we have been able to understand that this is the endometriotic deposits that is happening over the scars. So usually she will come with a cyclical pain over the cesarean scar. She will say that when I'm having my period, I'm having like pain over the cesarean scar. So that she gives very characteristic complaints, that points to a diagnosis of scar endometriosis. So usually that when you notice that scar, it should have enlarged a little bit, and it will be looking a little bluish because of the collection of blood under that. So these are with more increasing number of cesarean sections, scar endometriosis has also become a very common thing to be seen.
So doctor, how is endometriosis diagnosed? Is it through a scan, or what are the means and tools that a doctor uses to diagnose and pinpoint that this is endometriosis itself?
Now, the symptoms itself are so characteristic that as soon as the patient complains of these kind of symptoms, you know that, yeah, maybe you are dealing with a case of endometriosis. Moreover, we have to examine the patient like in every other case, and then this is a routine that we will be sending her for an ultrasound. Usually a vaginal scan is done. For an unmarried patient, we try to go for an abdominal scan, and in the scan you can look for cysts. Okay, the most common thing we see in endometriosis should be an endometriotic cyst, or we call it a chocolate colored cyst because of the clotted blood collection inside the cyst. Yeah,
in the ovary, right?
In the ovary. Okay. These endometriotic cysts are what is seen inside the ovary.
Okay.
They will be developing from the ovary, right? So they will be like that chocolate colored, like a little bit darkish colored. Yes, that is a finding on surgery, but on ultrasound you can see it like a cyst. And the cyst can be somewhere between 2 to 8 centimeter in size. As I told, initially they start becoming just with being very small cyst, and they progress over time. So that could be one finding, but there are a lot of other things that is happening. There is a lot of scarring and inflammation happening inside the abdomen, which can cause plastering of all the organs together because of irritation. But that cannot be seen on ultrasound. So if whenever we are planning for a surgery, it's important to understand the what is happening exactly inside. So sometimes in some situations we may have to go for higher modalities of diagnosis like MRI to exactly know if there is plastering, whether these organs are getting attached together because of the endometriosis.
So once it's been diagnosed, then how do you go about the treatment? Will medicines help, or is a surgery required? What is the kind of treatment that you would suggest to the patients?
Endometriosis unfortunately does not have a permanent cure, but yes, when we are going about treating an endometriosis case, the main thing we look for is the symptoms, and the treatment will depend on the symptoms. So pain being the predominant symptom in most patients, symptomatic relief is one of the goals of our treatment. So if this patient has completed family, she is having children, but the problem is her period pain, so and it's not like very, very severe, it's just coming during the period maybe for 1 or 2 days, and the rest of the days she is fine. So you can start off with just mild painkillers. You can just start off with painkillers, okay? And if she is good to go with that, that will be sufficient for her. And because I said it's like a progressive disease, you may want her to come back for a follow-up.
So constant monitoring is required.
Yeah, exactly, because we want to make sure that it's not progressing much. And but suppose the pain is really severe, like I said that throughout the cycle she's having pain. So every day you can't take painkillers, right? So you will have to look for something that is stronger and can be more, controlling of the condition. So that is when you suggest oral pills, hormonal pills. These hormonal pills, they will control the effect of the estrogen, they will like kind of suppress. Our intention will be to suppress the menstruation. Like I said, the more number of menstrual cycles, the more chances of endometriosis. So suppression of menstruation will be a way to control her symptoms. So these pills will be like kind of given daily. She'll have to continue it daily for maybe a period of 3 to 6 months at least, so that between that time, whatever these deposits are there, they just, you know, undergo degeneration and they will be controlled. So that is one kind of treatment we give. Then other than oral pills, we have something like, have you heard of this copper T, intrauterine device? We are using it like a contraceptive method. So similarly, we have Mirena. We call it Mirena. Mirena is like the progesterone releasing contraceptive device. So it has a dual action. It can act as contraception, plus it can, you know, it is because it's releasing the hormone into the uterine cavity, it can, you know, control these endometriosis to a great extent. And that is a very effective method because you don't have the problem of, you know, remembering to take the pills daily.
Yes.
You can, it's just inside and it will stay there, like you can use it for 5 years and then replace it.
Okay.
So that's a very effective method. And yeah, that is about the medicines.
And what about surgery? Is that the last resort? Do you normally advise patients to undergo surgery?
So that is what I was coming to, like, so one of our goal is for the symptomatic relief. The next goal and very, very challenging one is to preserve the fertility, you know, and to restore the fertility for women who are suffering from infertility due to this condition. So that is where actually surgery plays a role, because if she is having endometriotic cysts, so we know that the cyst is, you know, damaging the ovary and bringing down her chances of, you know, conceiving. So that we may need to do a laparoscopy and remove the cyst. We, like if there is some plastering inside, these organs are getting adherent together, we need to cut the scar tissue and, you know, make the organs anatomy and their relationship with each other normal, so that the chances of her conceiving gets better.
Okay, but it can be done through laparoscopy or keyhole, as you mentioned.
That is
right?
what
It
we
need not
prefer
be
these
a-
days. That's
Okay.
what we prefer these days, because I think everybody knows laparoscopy like is to stay, because it, you know, it will reduce the tissue handling. When we are doing an open surgery, we may have to handle the tissues directly. That can result in more adhesions. So doing a laparoscopy, you don't have much of, you know, a longer scar or something, and better tissue healing, lesser post-operative
and
stay,
post-operative
lesser
care.
post-operative pain. So it's a better thing.
So doctor, before we wrap up, any message that you would like to share with our viewers on endometriosis?
Yeah, you know, we all women, we always give least priority to our health.
Very
That's
true.
all known, right? Like everything else is most important, and health is always our least and last priority. So, to all the lovely ladies out there, you have to recognize these symptoms that we discussed today, and you should not keep it for later. Try to go as early as possible to your gynae to just be sure that it is not something as debilitating as this condition. So that's it. Health is first.
Absolutely. So thank you so much, doctor, for explaining to us in detail about endometriosis. I'm sure it's an eye-opener for many beautiful, lovely ladies out there. Thank you so much. I appreciate you taking the time out to be with us today.
My pleasure.
So to all the lovely ladies, let me reiterate the message doctor gave you just now. Make your health a priority, because only if you're healthy and happy, you can take care of your family. So if you experience any of the symptoms that the doctor listed here, please don't delay it any further. Seek immediate medical attention. And the good news is there is a cure for endometriosis. So please stay safe and healthy and happy always. Till we meet again next time, this is Anupama signing off. Good night.